my name is Courtney Skinner. This is speech number 3 for CST 100. This is my audience. How many of you have or have had pets at some point throughout your lifetime? I'm going to assume that those of you that have had pets have accompanied your baby to the veterinary hospital, hopefully for good reasons. Now, I encourage you to think about your trip to the veterinary clinic and try to remember the faces of the staff that have helped you. How many of you can honestly say that you paid attention to the person that likely walked you to the exam room, got your pet's vital signs, and asked questions about your pet's health? It's okay. Not many people do. In fact, the majority of people see that first point of contact with the veterinary technician is kind of a nuisance because they basically just want to get in, see the vet, get out as fast as possible. How would you feel if I told you that first individual that you saw in the exam room is most likely the most important and influential part of the veterinary team? Every single team member, no matter their credentials or their title, is important. However, veterinary technicians are the glue that holds the veterinary clinic together. They are the individuals that take the most pride in the health of your fur baby and complete a wide variety of tasks to ensure that your baby is as happy, healthy, and as comfortable as possible. I know this because I am a licensed veterinary technician and I've worked in the veterinary field for the past 8 years. Today, I would like to discuss with you the job roles, required education, and the pros and cons of the veterinary technology field. First, I would like to discuss the job roles of the veterinary technician. The National Association of Veterinary Technicians in America stated that the veterinary technicians and technologists are educated to be the veterinarian's nurse, laboratory technician, radiography technician, anesthetist, surgical nurse, and client educator. This is a very introductory definition as to all of the roles that are required of the veterinary technician within the hospital. Credentialed veterinary technicians are educated on how to provide care for a variety of species, including but not limited to cats, dogs, reptiles, amphibians, horses, cattle, pigs. The list really goes on and on. This is actually a picture of my mom and I at our large animal fast track lab in McLennan, Texas. And this is one of my veterinary technician students kind of cuddling a pig post-neuter. Veterinary technicians are also required to learn the anatomy, compatible medications, nutritional needs, and the husbandry required of all of these species and more. The veterinary technician's duties are expansive. Their duties can range anywhere from cleaning, grooming, obtaining radiographs, running lab work, collecting lab samples of all kinds, even the super unfriendly ones, performing ultrasonography, assisting in surgical procedures, administering and monitoring anesthesia, placing feeding tubes, drug dosage calculations, administering chemotherapy. The list really goes on and on. Aside from these technical duties, veterinary technicians are also required to answer phones, call in prescriptions, fill prescriptions, discuss financials with the clients, which can sometimes be difficult, maintain controlled drug logs, manage support staff, maintain inventory, as well as they do a lot of client education. By law, there are only 3 things that licensed veterinary technicians cannot do: diagnose, perform surgery, and prescribe medications. Those 3 tasks are limited to only licensed veterinarians. Essentially, a technician is a veterinarian's best friend. They are his or her eyes, ears, nose, you name it, are responsible for it, and can most likely do it. Veterinarians rely heavily on their technicians to keep the flow of the hospital going, and most technicians do it gracefully while wearing a smile. Now that we have discussed the various roles of the veterinary technician, I would like to discuss the requirements in order to become credentialed. A large majority of credentialed veterinary technicians have graduated with an associate's degree of science in veterinary technology from one of over 230 programs throughout the United States, accredited by the AVMA, or the American Veterinary Medical Association. There is also a 4-year option in which you obtain your bachelor's degree and then be labeled as a veterinary technologist. However, there are not nearly as many programs for this. Post-graduation, an individual must then kind of research and find out the requirements of the state in which they reside and plan on practicing medicine. Most states require the graduate to take their VTNE, or the Veterinary Technician National Examination. This is a very rigorous and difficult examination that is comparable to the NCLEX RN for nurses. Some states that require applicants to take a jurisprudence exam, which basically tests a person's knowledge on the laws, policies, procedures, and the exact scope of practice that is allowed within that state. Once these examinations are passed, the individual is issued a license certificate or registration certificate and can only then be labeled as a licensed, certified, or registered veterinary technician. This is an example of one of the veterinary licenses. There's also a smaller copy that you have to renew every year and that you have to keep in the veterinary clinic for every practice, as well as they hand you kind of a wallet card, essentially with your number. But this kind of achievements after going to one of the associate's degree programs, passing the VTNE. Luckily, Virginia does not require jurisprudence exam, so then I obtained my licensure. Currently, there's a lot of discrepancy between states and their laws regarding veterinary technicians. In some states, it is actually illegal to call yourself a veterinary technician without the legal state-issued credentials. In contrast, some states do not actually have a licensure requirement at all. Therefore, the scope of practice for those individuals is very loosely defined. The National Association of Veterinary Technicians in America, or NAVTA, has started enacting something called the Veterinary Nurse Initiative. This is basically an initiative that they're trying to provide and work towards provide an even platform and kind of level the playing field for education and credentialing throughout all 50 states. It is the hope of NAVTA that the Universal Credential Education requirement will help veterinary technicians gain more respect from other medical professions in the community. Now that we have discussed the education requirements and licensure process, I would like to discuss some of the pros and cons of being a veterinary technician and choosing it as a profession. First, I will start with the positive aspects of the job. Obviously, one of the major pros of being a veterinary technician is spending time with the patients. Everybody thinks that we cuddle puppies and kittens all day. It's not always that pretty, but we kind of love all of our patients, no matter the age or species. And also, sometimes their owners are actually really cool. Sometimes we get the really mean ones, but the majority of the time, I really enjoy my clients and kind of talking to them and forming relationships. I conducted a personal interview with my mother, Lori Skinner, who is also a licensed veterinary technician. During this interview, I asked her about aspects of the job that she thoroughly enjoyed, as well as some of the things that she believed may make one stray from the profession. When I asked her about some of the positive aspects of the job, she stated, "The most rewarding aspect of the job to me is being able to help my patients. I love being able to see the healthy patients walk through my doors excited, but I also love being able to follow through on a case with a sick patient until they get to go home because they are better. I also really enjoy educating clients and making them understand a difficult subject." This is actually one of my babies, Potter. This is when he first came into our veterinary hospital, signed over to us, and he came in actually basically without a heartbeat. We managed to resuscitate him. He was maybe 1.5 pounds at that time. This is him now, 1.5 years later. It's super fluffy. He has a haircut, but that's just kind of one of those rewarding things, being able to see through patients from basically them being on their deathbed to complete health. From personal experience, being a veterinary technician is a physically demanding job with long, grueling hours. Aside from it being physically exhausting, it's also very mentally taxing. Not only are you lifting and working on patients that are sometimes bigger and stronger with you, and less basically not willing to cooperate with you, but you also have to perform tasks, such as euthanasias, that can be mentally taxing. When I asked Lori about her least favorite parts of the job, she stated, "The lack of pay and benefits are, by far, the most difficult to cope with. You learn how to manage your emotions through difficult situations, but the lack of appreciation, pay, and benefits can make anyone consider another career." People do not realize that although vet techs have a very wide scope of practice, their pay does not reflect their abilities at all. According to the Bureau of Labor Statistics, the median pay for credentialed technicians is $15.62 an hour. However, this does not mean that every single technician makes that much. The lower end of the range sits about $10 an hour, with the upper end being kind of about $20 to $23 an hour. However, according to the BLS, or the Bureau of Labor Statistics, the job outlook for veterinary technicians and technologists from 2016 to 2026 is 20%. They're hoping that it grows by 20% by that time, which is definitely much higher than the national average. It's definitely a very fulfilling field, but they're also in need of people wanting to actually be veterinary technicians. Today we have discussed the various job roles of the veterinary technician, educational licensure requirements, as well as a few of the pros and cons of being a veterinary technician. I hope that I open your eyes and minds to this rewarding but difficult career. In closing, I would like to leave you with a rather long anonymous quote that I feel helps summarize everything that we discussed today. It states that I'm an anesthesiologist, a radiology technician, a maid, surgery assistant, phlebotomist, ultrasound technician, critical care technician, a loving hand, pharmacist, teacher, a shoulder to cry on, friend to cry with, a sucker for a furry face to lick, a midwife, a dental hygienist, a vet's best friend, and a pet's best friend, a babysitter, physical therapist, mother, playmate, chew toy, protector, and cleaner. I can make the pain go away, save a life, see what's wrong, clean anything, ease a mind, fill a drug order, show the right way, and suffering, give kisses, get kisses, and clean teeth. I have a strong stomach, endured countless scars, scratches, and bites, cried with a stranger, cried into the fur of too many lifeless bodies. A big heart, a thoughtful mind, the strength to do the right thing even when it hurts, the ability to fall in love in 5 seconds, and the deepest love for all creatures. My wallet is always empty, but my house is always full, and there is always room for one more baby to save. I'm a veterinary technician and proud of it.